Hi, I'm Dr. Laura Fink. I'm one of the veterinarians here at Columbia Pike Animal Hospital and Emergency Center. And today we're going to talk about senior cat care. As cats get older, I'd say there's a few things that we tend to see. One of them is true medical problems. So cats will start losing weight, start being more lethargic, just not playing as much. Their appetite or the water consumption might change, and that can point to underlying medical problems that we should be addressing. In addition, cats get arthritis, just like everyone else. And that's something that because cats hide a lot of things, it's not really obvious signs, and that's something that's really easy to miss. If cats are in pain, they don't tend to cry. They may not even limp, even if they have significant arthritis. But what you see is behavior changes. So instead of a cat that's, coming out to greet you, interacting with the family, playing with toys, getting the zoomies, they tend to just kind of be there. Cats, they're vertical creatures, so they tend to jump up on things. And so I like to ask people, if their cat's still jumping up on things, and sometimes the answer is like, well, no, they don't jump on the counter anymore. They kind of struggle getting onto the couch. Like, that's a cat that's in pain, because cats, again, they're vertical, they go up. And if they stop doing that, it's because it hurts too much to jump. As your cat becomes a senior, I think what they eat is important. Practically speaking, we want a well-rounded senior cat diet. One of the major companies that does good product quality testing uses veterinary nutritionists to formulate their diet. And as long as your cat doesn't have any medical problems, a good quality cat food is really all they should need. If we start seeing some arthritis, there are arthritis supplements that we could add into the diet. And then if we find any medical conditions, a lot of those are treated with various prescription diets. Cats, even as they're seniors, even if they're indoors only, they always need the rabies vaccine. It's Virginia state law. It's also a really good idea because rabies is a really serious disease. Past that, every cat should have their FVRCP vaccine, which is a vaccination combo they get every 3 years. If your cat goes outdoors, they should still get their feline leukemia vaccine, but otherwise the rabies and the FVRCP are the only two vaccines that they need. Honestly, the best time to get your cat to a good weight is before they're a senior, because when they're a senior, their metabolism slows down. It's that much harder. Now, that being said, if we end up with a senior kitty who's overweight, getting that weight off of them is still really beneficial, particularly for their joints. Practically speaking, it's all about the calories, kind of cutting back on the number of calories your cat's getting, both in food and in treats and such. If we cut back on the food and we're still not making a difference, there are prescription weight loss diets that we can use as well. As cats get older, the teeth do tend to get worse over time, just like people's. So we'll tend to see a lot of plaque build up, and then when that plaque sits on that tooth, it irritates the gums recede, and then our teeth can get loose and therefore painful. In addition, cats will have kind of their own type of dental disease called resorptive disease, where the plaque builds up on the tooth. The body doesn't like that plaque. It tries to eat away the plaque, and it will actually eat a hole into the tooth itself. Resorptive lesions can be really, really painful, and that's something that we generally need to extract that tooth to make the kitty comfortable again. I think the number one thing we tend to see is weight loss. So cats, they hide things. Sometimes their behavior doesn't change until they're really sick. But, kind of gradual weight loss is one of the red flags that we tend to see if someone comes in with an old kitty and it's just not quite himself lately. Well, we look at the chart, they weighed 10 pounds last year, they weigh 8.5 pounds this year. And that weight loss can be really gradual, where it's hard to see at home, which is why getting older kitties examined a couple times a year is a good idea. But yeah, weight change, appetite changes, whether it's either a stronger or a lesser appetite, and then changes in water consumption are the big red flags. Most people don't know how much their cat drinks, but it's really how big the clumps are in the litter box. If they go from this big to this big, the cat's producing a lot more urine, and that's a concern. If you have a senior kitty that's underweight, the first thing we do is try to figure out why, because often there's a medical reason. So hyperthyroidism is really common in older cats. Your thyroid's essentially overactive, your metabolism's running too high. Your kitty can eat as much as they want and they'll still lose weight. And if that's the case, it's essentially a daily medication, and all of a sudden we have a cat that, every calorie that goes in actually stays on them and they gain weight really well. There's some underlying conditions that just make cats nauseous, things like kidney disease. And then the answer is nausea medications, so that they don't feel sick and they want to eat. We have appetite stimulants we'll use for certain conditions as well. And then sometimes just being aware, what food does your cat like? Because there's the ideal diet. Eating is more important than what you eat. So if we have a kitty with kidney disease and they will not eat the kidney food, we have to put them on a non-prescription food because they need to eat. Cats can develop food aversions too, so if they were eating a food when they were getting sick, even if we got them feeling better, sometimes they don't want to eat that food because they associate it with feeling poorly, and then it's kind of switching around until you find a food that kitty is willing to eat well. Cats tend to hide things, and that's where, we always say, oh, keep an eye on them at home, keep an eye out for changes in weight, changes in eating, changes in drinking. Well, some of those changes can be really subtle, or the kitty truly feels good until a disease hits a certain level of severity. And that's why the other thing we recommend to senior kitties is seeing them twice a year. Checking their weight, examining them, feeling their lymph nodes, feeling their belly. Sometimes we'll find things before the cat starts feeling poorly. In addition, checking blood work on senior kitties is really important because that's how we pick up kidney disease or thyroid disease or electrolyte abnormalities, again, before the cat starts feeling really sick. So I think having a senior wellness plan is great because then it lets you do the screening that helps keep your cat healthy without worrying about the exact cost each time. Thank you for watching this video. If you have any questions, feel free to reach out to us. We're here 24 hours a day.